Good day and welcome to the St. Louis County Department of Public Health. Today we are talking about COVID-19 and an explosion in new cases. I'm Christopher Ave and I'm joined here by our Chief Medical Officer, Dr. Emily Doucette, as well as our Director of Communicable Disease Response, Nebu Kolancherry. Thanks for being here. And we are going to learn now more about what this increase in COVID-19 cases really means and what you and I can do to protect ourselves, our loved ones, and our community. So Nebu, as we sit here in early January, as we're taping this, we're seeing the highest number of new COVID-19 cases ever in St. Louis County. So my questions for you are, what does this actually mean for us? And what are some steps that we all can take to protect ourselves and our loved ones?
So you're exactly right, where today is the highest rate of cases and hospitalizations that we've ever had over the course of the pandemic in St. Louis County. And to put that in perspective, 3 weeks ago we had about 2,800 new cases, while last week that number went to 12,000. We haven't seen that steep of an increase really ever. And what that means to the average person is that they are most at risk than they have ever been for being exposed to COVID-19 while living their everyday life. And on average, what that means is about 1 in 12 people in St. Louis County currently are COVID positive and may be infectious. And, most of us see way more than 12 people in any given day while living our lives. Now, while that may seem kind of, hopeless, the good news is that we still have every tool that you need to protect yourself in our toolbox. First and foremost, at this state, it's masking and social distancing. And the best evidence that works is in our classrooms, in schools and in universities, where while people have been getting COVID outside of the classrooms, children and students, university students, have really not been getting COVID by being in class. And the biggest reason is that they are masked. So we know masking works, and we know social distancing works as well. Right now, it's probably also wise to really think about avoiding large social gatherings, especially if you or someone that you love are at high risk for contracting COVID and getting severe disease. So, let me tell you what that means for me. The most vulnerable person, if you will, in my life is my best friend's 8-month-old kid, Jack. And Jack can't get vaccinated, so what I do is I'm not going to see Jack for quite some time until I feel like it is safe to do so. The next most important thing, again, is as we've stressed throughout the course, as we've stressed as much as we can, is the vaccination. Now, while the Omicron variant is new, the vaccine is still very, very protective against severe disease. It'll keep you from going to the hospital. And it'll also protect you from, it'll offer significant protection to you if you're boosted, it'll offer significant protection to you if you have a booster dose from getting the disease.
Good deal. And so if I am trying to figure out, is it worth it for me to get vaccinated, or is it worth it for me to get boosted, what would your advice be?
Well, I'd say it's the single best tool that you have to protect you and also the people in your life that you love. I mentioned that last week we had 12,000 new cases. Over 70% of those were in people who didn't get the vaccine. And those are great odds, and I would play those odds.
Excellent. Thank you. Dr. Doucette, the CDC recently changed its guidance on isolation and quarantine. What can you tell us about these changes, and what is your best advice for residents of St. Louis County who face choices in those areas?
So the CDC did release new isolation and quarantine guidelines last week, really based on emerging evidence about how Omicron spreads differently than previous strains of the virus that we've seen throughout the course of this pandemic. So I think it's really important when thinking about these new guidelines that really everything needs to be interpreted in context. And the context of these guidelines and the basis of the guidelines for isolation and quarantine are all tied to masking. So I think that's a really, really important piece here, that this operating under this new guidance is really focused on the masking behavior of the individuals involved. So we'll break it down a little bit by isolation and quarantine, and just to kind of clarify those terms, because I know they get thrown around a lot. Isolation is focused on separating someone who is ill, right? Someone who has COVID-19. So if you test positive for COVID-19, or if you have symptoms of COVID-19 and you have been around someone with COVID-19, even if you can't get tested, and that can be challenging right now, you should assume you have COVID-19 and you should isolate yourself from other people. So I want to make it clear that isolation is completely independent of vaccination status, right? If you have COVID, you have COVID. No matter how you got there, no matter what led you to that place, and whether or not you were vaccinated beforehand, you have infection and you are at risk. You're a risk to other people, those you love and those around you. You're at risk of transmitting that virus for up to 14 days after your first symptom of COVID-19. And that's kind of the longest period of time that we know you could transmit that virus. For the most part, people will transmit the virus within the first 10 days of illness, and increasingly in the Omicron environment, in the first several days or even those first 5 days of illness. So that's kind of why, I think it's really important to put in context that you can transmit that virus for quite a period of time. Most of that transmission is likely to happen early on, but your risk to other people at day 5 or day 7 is not zero. And so it's really important to think about the people that you're around, your loved ones, and what their risk factors are, and frankly, the risk factors for the community broadly. So when I think about this, I really recommend people thinking of this as a 10-day period of behavior modification and isolation to try to support the people that they love and the community as a whole, right? So when you're thinking about that 10-day period, these new guidelines kind of give a course for people who are in certain situations to make modifications to that based on the way that they're presenting with illness and how the illness is individually affecting them. So if you have COVID-19, no matter what, for the first 5 days that you are sick from the beginning of your symptoms, or if you don't have symptoms from the time that you first test positive, for that first 5 days, you need to isolate yourself from other people. That means staying home and not being around other people in your home to the extent that you can manage that in order to protect them from getting sick. So after that period of time, there's kind of two pathways that diverge. One, if you have symptoms of COVID, or if you do not have symptoms, so you're asymptomatic, you feel great, no cough, no shortness of breath, no fever, it is, the new guidelines say that you can leave your isolation, leave your home, do the things that you need to do in your life for the next 5 days, right, for that 6 to 10 day period, if you can maintain masking the entire time you are outside of your home. CDC is currently looking at the requirement for testing at that 5 day mark, right, to determine if it is safe for you to leave isolation and be around other people. So that is not something that is officially recommended by the CDC at this point. DPH is taking the proactive approach and strongly recommending for citizens of St. Louis County that when you hit that 5 day mark and you have no symptoms and you're considering leaving your home, you should get an antigen test And antigen tests tend to be those at-home rapid tests that you can run in 10 or 15 minutes. If that test is positive, you are, the way that we're using that test is kind of emerging, but we believe that positivity of that test is associated with your ability, with a high transmissibility or high contagion to other people. So if your test is still positive, you should continue to stay home. And that is a recommendation that we're making at this point for the protection of our community and the protection of those people that you love. So that's if you have no symptoms. If you have symptoms, you need to stay home until your symptoms resolve in that 10-day period. Pretty straightforward. And I think, again, throughout that 10-day period, it's really an important focus on thinking about the things that you're doing and what needs to happen outside of your home, right? If you are in critical infrastructure, right? If you're if you're in critical infrastructure and you really need to leave your home to go to work and that's something that you need to do, there's a path for that through these guidelines. That said, if you can work from home, if you're allowed to and you can do that well, stay home for 10 days, right? and really think about the types of things you're engaging in. I would certainly not recommend elective social gatherings or certainly large gatherings of any kind during that 10-day period. So that's isolation. That's if you have COVID, right? So the other category that's new is quarantine. And quarantine is the word that we use to separate people who are not ill, but have had a close contact with someone who has COVID-19, right? And this, so I think there's something, the thing that is similar to isolation is that, again, this is completely tied to the ability to mask and the masking behavior. The thing that's different is that it is also tied to vaccination status, right? So there are, again, so let's say that you have come in contact with someone with COVID-19, you know you've had that exposure, you're feeling well, you're fine right now, but we're trying to determine if you are likely to develop COVID-19 into the future. You can get COVID-19 again for up to 14 days after that last exposure, but it's much more likely in this environment to happen on the much sooner end of that time frame. So I would say at this point for quarantine, there are kind of, again, two separate paths. And there's one path for people who are unvaccinated or people who have had their primary vaccination series, but it was a while ago. And we consider a while ago to be more than 6 months after your Pfizer or Moderna vaccine, or more than 2 months after your Johnson & Johnson vaccine. So if you're unvaccinated or you haven't been vaccinated recently, then you need to stay home for 5 days, even though you feel well. And then you can leave your house with a mask on 100% of the time for the second half of that quarantine period for those second 5 days. The other category, so that's if you're unvaccinated or not recently vaccinated. If you are recently vaccinated or if you are boosted, you're in a separate category, right? And that's our kind of path two. So if you have been vaccinated with the primary Pfizer or Moderna series or the Johnson & Johnson series within the last 6 months for Pfizer and Moderna, or within the last 2 months for Johnson & Johnson, or if you're boosted, right? So you've gotten that either second or third dose of the series, at that point, you do not need to quarantine. You need to wear a mask 100% of the time for the next 10 days that you're outside of your home and limit your contact with people who are high risk. We do recommend that everyone who is quarantined, whether they are staying in their home or not, at that 5-day mark, again, take a COVID-19 test and to try to understand if you have COVID-19 or are likely to get it. And then, of course, at any point, if you develop symptoms, you would definitely want to immediately go home and look for ways to get tested. So I think the really big change here for quarantine is that quarantine at home is now required for people who have had a primary vaccine series a long time ago and haven't been boosted. And that is really completely new to this guidance, and that is focused on the fact that there really is some emerging data coming from internationally in places where we had those Omicron spikes happened earlier on, that the effectiveness of recent vaccination and particularly boosting is really important to protect people against Omicron.
Now this question is for both of you. We know that Omicron is highly transmissible, that it's much more contagious than previous variants like Delta. However, Omicron also tends to produce less severe symptoms and a little bit lower chance of hospitalization among people who get it. So the question is, why is Omicron such a big deal? Why are we so concerned with this big increase in cases of Omicron?
Sure. So I think there's a really wide range of what symptoms look like for different people. So we can make generalizations about how symptoms affect people as a whole, but obviously individual disease is very individualized, right? And it's based on someone's immune response, how much immunity they already have built up against COVID-19. It's a super complex process. So to say that disease is always mild is inaccurate, and there are people that become severely ill, and there are people that die related to this illness. So I think it's really important to think about the context of the risk of people involved and the symptoms as they present. It is true that more people are asymptomatic or don't have any symptoms when they get Omicron. And it is true that oftentimes, and for many people, it represents as pretty mild upper respiratory illness. We are seeing quite a bit less of loss of taste and smell with Omicron compared to other strains, which honestly just makes it even more confusing in the middle of winter during a flu season with all kinds of other stuff going around to try to figure out if what you have is Omicron or is COVID-19 or not. So certainly the symptoms can be variable for different people, but there are many people who are getting very ill from this disease. So I think it's important to kind of put that in the bigger context of the range of responses that any individual can have.
Yeah, and the part of this is essentially that a very small percentage of a very, very large number is still a very, very large number. And so, like Dr. Doucette said, early evidence says that the Omicron variant and the disease caused by it is a lot less severe. However, we are also seeing the largest amount of hospitalizations that we've ever had throughout the course of the pandemic. And what that means is that so many people are getting sick that the very small amount of people that are getting severe illness is still more than anything than we've ever seen before. And this has a couple of different implications. The first is our hospital capacity. So our hospitals are already at the tip of their capacity. And what this means is that soon they're going to have to start limiting the amount of care for non-COVID conditions that they can provide. That's all the more further exacerbated by the fact that hospital staff can get COVID-19 and they have to be in isolation as well. And the second and even more concerning thing is we're seeing the largest number of children that are getting sick than any other time before. And to give you a sense of that, about 4,300 kids got sick in St. Louis County in December. And that number's only going to get much higher as school reopens and kids start playing together. And early data out of New York is also showing that pediatric hospitalizations are increasing, which is particularly concerning for the health department. And so to that end, we continue to stress that you need to take every step to protect yourself and protect your children. So please wear a mask, please socially distance, avoid large gatherings, and get vaccinated and boosted as soon as you can.
Yeah, I think I'll add to that, I think it's really important for us to remember that while most people have the ability now to protect themselves against COVID-19 by getting vaccinated, we do still have a portion of our population, and that's those 5 and under, who don't have that option, right? And who are completely unprotected in this new environment. And that is scary, I think, for us at the health department. That is scary for me as a parent of unvaccinated children who, again, just aren't eligible yet to receive that vaccine. So I think it's really important to think of risk right now through the context of those around you who are unvaccinated, and particularly young children. Because bringing young children under the age of 5 who are unvaccinated to large gatherings and just being in environments in which there isn't masking is really a significant risk to those kids. And we're seeing spread in those groups in ways that we haven't before previously in the pandemic.